Dr. Burhenne here again, of AskTheDentist.com. So we get a lot of questions about what is a root canal. I think that question comes from a point of anxiety and fear. You know, what is it? It sounds pretty dramatic. It has a bad reputation. Comedians kind of refer to it and joke about it as being very painful or something to avoid. And it certainly is something you want to avoid. You can prevent having a root canal by having good oral health. But let's say you do get the root canal. It is a way to save the tooth. You mummify the tooth. You take away the inside necrotic, dying, diseased tissue. And at some point, a tooth will reach a point where it will irreversibly become inflamed and it will die, and there's no fixing it. So that has to be removed. If it's not removed, your body will expel that tooth, and it will be a very unsuccessful attempt at it. It could even kill you, can cause heart disease. It's a massive infection. In fact, probably back when we were recording these kind of things back in the 18th century, a lot of people were dying of gum disease and also of abscesses, infected teeth. So the root canal, you would go see your dentist or your root canal specialist, an endodontist, and they would drill a little hole inside the very top of the tooth. If you have a crown, they would go through the crown. If you have a filling, they would go past and through the filling. The smaller the hole, the better, because it doesn't weaken the tooth. And they would gain access to these canals. Molars may have 3 or 4 or 5 canals. A premolar would have 2 canals or 1, and some of the front teeth, an incisor may have 1 canal. Those canals have to be cleaned out and disinfected, and all that tissue has to be removed so that it's a bone dry and clean sterile canal. Once that's done, then they have to seal it and prevent the bacteria from seeping back in there. Once that tooth is mummified and sealed, hermetically sealed, the body perceives it as being a regular tooth. The little ligaments that attach to the tooth on the side, they do not know the difference, and that tooth will continue to function in the mouth like a regular tooth. Back teeth, once they're root canal, do need crowns. That's a different story. That's another video, but that's something you want to get done within 6 months of having the root canal done. The alternative, of course, is losing the tooth, needing a bone graft and an implant. And again, that's another video, but if you can do the root canal and if it's properly done, it's a great way to save the tooth.